say that those two things don't help you very much and you're not feeling a lot of relief. I'm going to talk to you about some things we can provide you here at the clinic that are clinically proven, level 1 medical evidence that they're very effective at helping people with nerve pain and neuropathy. We have found that combination treatments using multiple modalities is the way to go with this, because if you do one thing, it gets some better. You can get everybody a little bit better, but if you really want to get better from neuropathy, you have to do, in my experience, you have to do these combination therapies, and we're going to talk about those. What we use at our clinic is a combination of 4 foundational therapies. Now, these are not all of our therapies. If you do these 4 and you're not getting better, we have many backup therapies that we can provide you with. But basically, the first one is a class 4 laser therapy. This is a very expensive piece of medical equipment. It penetrates very deeply into your tissues. It causes what's called photobiomodulation. Basically, we have photoreceptors, it's just like photosynthesis. Trees have photoreceptors. When they're stimulated by the sun, they make energy. That's why, basically all energy on the planet comes from the sun. The entire world, every form of energy, whether it's gasoline, whether it's electricity, all comes originally, you can trace it all the way back to the sun. It all comes from light, and this is light therapy. By itself, laser therapy has a 90% effective rate if you treat diabetic neuropathy. 90% of patients will feel better in clinical trials. Next is electrical signal therapy. This is basically like exercise for the nerves. I like to call it retraining the nerves, where we basically stimulate the nerves in a very complex, deep, varied fashion so the nerve doesn't get used to it. Basically keeps tricking the nerve to keep working. And this is a pretty expensive machine, but it works very, very good. Has by itself an 87% success rate. Now, what that means in those studies is that half patients got 50% better, 87% of them got 50% better. It doesn't mean that you got 87% better on every patient. So, but still, in treating neuropathy, that's a pretty high success rate. The next is home red light therapy. And the reason we use this, it's similar to laser therapy. It's like phototherapy. It's not quite as deep. It's similar to this laser therapy, but it's also consistent. We want you to use this twice a day. You take this unit home with you. It's a medical grade light. It's not like the little ones you buy on Amazon or eBay. These are basically units that have to have a lot of energy put into them. They have to have the right frequencies, and if you use them consistently, they have a very powerful effect on nerve regeneration. And lastly is the nutritional support that we talked about. We use this on every patient that undergoes our neuropathy protocol, and this 4-part pattern has an extremely high success rate, because if you combine 90% effective rate, 87% effective rate, 85 to 90% success rate, and 90% success rate in 4 different modalities, you're going to cure a lot of people and reverse their neuropathy, at the very least manage it tremendously, as long as your blood sugar is under control and as long as your diet is good as well. So those are four things we do here at the clinic. Now, what if I told you that there is something that's available that's been around since 1980, that for years was poo-pooed by the medical community, that has a very powerful effect on peripheral nerves in the right patient, and that this treatment has somewhere in the neighborhood of a 90% success rate beyond this stuff, and it is extremely effective in patients that have, in particular, peripheral, very distal nerve disease, like the bottom of your foot or the palm of your hand, or sometimes it's on the leg, going down your leg. That would be surgical intervention. We'll talk about that next.